I'd like to welcome everyone to today's webinar Wednesday. The presentation is entitled Diabetes, Don't Take It with a Grain of Sugar. Today's presenter is Dr. Christine Lay from Kelsey-Seybold's West Clinic. She earned her medical degree at Touro University College of Osteopathic Medicine in 2001. She completed her internship and residency at Memorial Family Practice in 2002. She's board certified in family medicine. She's been with Kelsey-Seybold since 2002, and she enjoys jogging, gardening, fitness, and traveling. I'm going to turn it over to Dr. Lay now.
Well, good afternoon. I'm glad to be here, and we're going to start with a pop quiz. True or false? Does diabetes increase your risk of having a stroke or a heart attack? The answer is true, and we're going to talk a little bit about that through our presentation here. First, I'm going to talk a little bit about what diabetes is. Primarily, when we think about when you're eating lunch, what you're having for lunch today, the energy needs to be broken down by enzymes called insulin that's in the pancreas. If the food isn't broken down, then the sugar can stay in the bloodstream, and it can also cause the body to feel out of balance. Type 1 diabetes, we'll just focus on it a little bit. It's very rare. Out of 100 people who have diabetes, only 10 of them will have the type 1 diabetes, which happens in children. This type of diabetes happens when the child's body does not make insulin that breaks down the food. Type 2 diabetes, this is the one we're going to focus on because this is the one that we most commonly see. Most of the time this will happen in adults, and it has to do with our bodies making insulin, but our bodies not being able to use the insulin that is made. Most of the time the biggest risk factor is going to be obesity. This is eating more food than your body needs. Secondly, also family history. If you have more than one family member who's blood related to you, you have a higher risk of diabetes. And lastly, genetics. There are certain ethnic groups that may have a higher risk of diabetes. It is alarming that diabetes is becoming an epidemic in the U.S. Over 25 million people have diabetes, and primarily the main risk factor is going to be obesity. If these trends continue, it is pretty scary to think that 1/5 to 1/3 of all Americans will have diabetes by the year 2050. Diabetes is a rapidly growing health risk. Both type 1 and 2 increase the aging of our cells, and also it increases the risk of heart disease, which is the #1 medical killer of Americans. In fact, diabetes doubles the risk of heart attack and stroke. If we look at the numbers of diabetes in the U.S., almost 20 million people have already been diagnosed with diabetes. What we're trying to do is we're trying to identify people who are at risk and recommend that they make lifestyle changes to prevent their progression to full-blown diabetes. A lot of times diabetes causes the blood vessels to get smaller, and because of this it can increase the risk of other health complications that would include heart attack, stroke, high blood pressure, blindness, kidney disease, infections, numbness of the hands and the feet, blindness, and even pregnancy complications. Did you know that with diabetes it actually decreases one's lifespan? Oftentimes this does this because the diabetes causes the blood vessels to get smaller, and it really increases risk of a heart attack or stroke. Most of the time, for people who have type 2 diabetes, 80% of the time that will actually cause their death is from a heart attack or stroke. This is important. The best way that we can tell about diabetes is to check the blood sugar level. This can be done in two ways, either with a glucometer that can be done oftentimes in the clinic or through a blood test. The blood test that's done fasting, less than 100 is considered normal. If it's 100 to 125, the person has a risk of diabetes in the future. And if the level consistently stays above 126 before breakfast on 2 different days, there's a very high risk that this patient may have diabetes. Oftentimes patients will ask me, Dr. Lay, how would I know if I have diabetes? Oftentimes when I see patients, they do complain about symptoms that may include fatigue. Who doesn't have fatigue sometimes? Sometimes they will complain about blurry vision, being very thirsty, being very hungry all the time, and sometimes having an unusual weight loss. These are going to be red flags that it might be a good idea to schedule a routine physical if you haven't scheduled one already, or to go ahead and visit with your physician if you're feeling different than you usually do. I do like to talk about diabetes because most of the time in the U.S. it is caused by poor lifestyle choices, including obesity and having a sedentary lifestyle. We do know that the heavier a person is, the greater the risk of developing type 2 diabetes. So in terms of prevention of diabetes, it's very interesting because lifestyle changes are what we're focusing on. It's as simple as eating a little bit healthier and increasing up a little bit of aerobic exercise. And also what this figure shows here is the waist circumference is very important. The waist circumference should be less than 35 inches in a woman and less than 40 inches in a man. And this will definitely decrease the risk of diabetes and other medical problems. So the top prevention tip that we found out is physical activity. For most people to be heart healthy, the heart only needs a certain number of minutes to be healthy, and it's 30 minutes of exercise a day for 5 days a week. So we're looking at 150 minutes a week of keeping the heart healthy. Oftentimes what we're looking is aerobic, which means either walking fast, briskly, or jogging a little bit, getting into the fat burning zone. And what this does is it will increase the metabolism, and it will help to promote weight loss. It will help to decrease the blood sugars, and it will also help for the body to be able to use the insulin. We talk about 150 minutes of exercise for being heart healthy. Most of the studies have shown that it's actually 180 minutes of aerobic activity a week will decrease the risk of diabetes. Number 2, we actually found that eating plenty of fiber will actually decrease the risk of diabetes. So foods that are high in fiber, which may be fruits, veggies, beans, whole grains, nuts, and seeds, this helps out a lot. This will decrease the risk of diabetes and also lower the risk of heart disease. It also helps patients to feel fuller. Additionally, we want to choose whole grains. And whole grains can come from different foods, wheat, pasta products, and some cereals. Oftentimes the packaging will say whole grains on that. So once again, we talked about lifestyle changes. We already talked about trying to exercise, ideally 150 minutes to promote heart health and 180 minutes to improve metabolism and lose weight. In terms of losing the weight, if you look at the American Diabetes Association, we found that whatever weight a person is, if there's risk, if they lose anywhere from 5 to 10% of whatever their starting weight is, it will decrease their progression to diabetes within about 6 months to a year. Also, additionally, as I had talked about before, diabetes causes the blood vessels to get smaller, and it does cause problems that way. Because of that, we definitely recommend, if you smoke, please set a quit date. We find that patients are more successful if they set a quit date at least 3 months in advance. We also know that if you have a routine physician who you see, you will definitely become more successful. And definitely, if you are diabetic or pre-diabetic, please do not start smoking. Many patients will ask me, is it possible to reverse diabetes? And it's true. If you look at the American Diabetes Association, on the left-hand side, it talks about ways to try to prevent diabetes as much as possible. Looking at this slide here, we see salmon, and salmon has high omega-3s, which helps to decrease the risk of diabetes and other heart issues. Once again, we talked about exercising. Carbohydrates and starches is also very important to cut down to decrease the risk of diabetes. This is important also. Some of my patients, when they have very good lifestyle changes, they slack off. I had one patient who was doing very well, and he started eating 2 boxes of Chips Ahoy a day, including unlimited Kool-Aid. When he did this, his sugars not only doubled, but they tripled. And so it's very important to try to maintain healthy lifestyle choices to prevent the progression of diabetes and maintain healthy habits. Of course, here at Kelsey, working with a physician is important, but we also have other people who can help to improve the sugars, and these people include our certified diabetic educators. We also have diabetic education classes, registered dietitians, and then we also have our wonderful team of nurses at the health information systems that's complimentary for our patients. Once again, in terms of management of diabetes or elevated sugars, I think it's very important to, number one, try to be as healthy as possible, which means trying to be at a healthy weight and height. If a physician recommends medicines, it's important to take the medicines daily. Also to visit the physician's office at least every 3 months to get the test called the hemoglobin A1C that lets us know how well controlled the sugars are. These are other information resources that could be very helpful. The Kelsey-Seybold.com website is very good. The Kelsey Research Foundation Health Information Center is a great resource. And one of my favorites is the American Diabetes Association at diabetes.org. And so now I'm going to turn it back to Elliot, and we may be looking at some questions.
Okay, we're going to take a few questions now. Okay, if you just be patient for 1 minute, Dr. Lay is going to read some of your questions and respond. And this would be a great time to ask any other questions you might have had about the presentation.
Well, I'm going to take a look at some of these questions, and some of these are very good. So I'm going to answer the first one here. It says, what, in your opinion, is the lifestyle factor that is most likely to increase the risk of developing type 2 diabetes? Well, in the U.S., honestly, the biggest risk factor is going to be fast food. I know that patients sometimes are in a rush, but really as a family physician, we recommend fast food no more than twice a week. Additionally, what we found is those sodas are very bad for people. It really increases the risk of diabetes. And so those are the 2 biggest lifestyle changes I would recommend for patients. We noticed there was a recent study in China, and over there they're trying to become more Americanized like the U.S. and eating a lot more fast food. And we have noticed a trend that for those Chinese who are eating a lot of the fast food, their risk of diabetes is actually increasing at a rate much higher than in the U.S. There's another question that I think is very good, and this is, if diabetes is weight-related, why is it that diabetics can lose weight but still have the disease? I would recommend for patients to look at the American Diabetes Association website. It talks about risk factors. And of course, what we talked about is obesity, which obesity is a risk factor we try to decrease that as much as possible. Secondly, there is family risk factors. So for example, I may have a patient whose parents are diabetic, whose grandparents are diabetic, whose brothers and sisters are all diabetic. Unfortunately for that patient, even if they eat very healthy and they maintain very good lifestyle changes, they have a much higher risk of diabetes than other people. And even if they do everything right, unfortunately, they may have a risk of needing to be on medicines because of the family history. Another good question is, if your blood sugar stays within the normal range for an extended time, does this mean that you no longer have diabetes? Let me explain that a little bit. So if a patient, as we said, has blood sugars in the morning consistently above 126, most of the physicians would recommend that the patient make lifestyle changes for what we had talked about, including exercise and eating healthier. If the patient over the next 3 to 6 months, if their sugars become less than 126, perhaps it's 99, then there's a very high risk that what they had was diabetes that was due to poor lifestyle. And if they're able to maintain the healthier lifestyle, we actually can tell the patient that you may no longer have diabetes. Another good question is this: what percentage of type 2 diabetics eventually become type 1 diabetics? For the type 1, it's going to be the 10 patients out of 100 who are type 1, and those are going to be children whose bodies don't make insulin. For many patients, it can be very confusing. Unfortunately, for people who are diabetic, if they tried lifestyle changes for many years, after about 10 years or so, those tablets can stop working. And unfortunately, we may have to add a little bit of insulin. And so it's a natural progression of diabetes. And so many patients who've had diabetes for 10 years may need to be on tablets in addition to insulin. We still would call that person type 2 diabetes on insulin. We wouldn't call them type 1 diabetes. Let me see. Another question is, do you think a patient should see the dietitian if they are considered pre-diabetic? Absolutely. I think if the fasting sugars are consistently above 100, we've got plenty of time to try to prevent diabetes as much as possible. For what I mentioned before, we want to try to start exercising, eventually building up to 150 minutes of aerobic exercise a week. If the sugars are on the higher side, we want to go ahead and slowly build up to 180 minutes of aerobic exercise a week, in addition to trying to lose a little bit of weight, wiggling it down anywhere from 5 to 10% of where the person was at baseline. Let me see if there's some other good questions here. Another good question is about the A1C test, and they're asking how often that should be done. The hemoglobin A1C is a blood test that checks on the red blood cell, and it can be done as early as every 3 months. There's a couple different ways of checking for diabetes. We did talk about the fasting blood sugar, and so under the American Diabetes Association, there's 3 ways of checking for diabetes. Number 1 is the fasting blood sugar of greater than 126. Number 2 is a random sugar anytime consistently above 200. And the third option is doing a hemoglobin A1C blood test that is 6.5 and above. Most of the time we look at two out of 3 of those abnormals before we tell someone that they're diabetic. If the A1C levels consistently stay lower than the 6.5 and the patient is no longer on any medicines, we can actually tell the patient that you are no longer diabetic and you're in the higher risk of diabetes, but continue lifestyle changes. It looks like we may only have time for one more question here. And it says, if I have a family history of diabetes in my mom, does it mean that I have a higher risk? Absolutely. So when patients visit the doctor, especially for the wellness exams, most of the time physicians will ask if there's a family history of diabetes because it means that it's time to start about promoting healthier lifestyles. Oh, I see. Well, here's another question that's interesting. A patient asks, my family member has diabetes. Is it okay to eat cereal? As I mentioned before, fiber is actually very good to help decrease the risk of diabetes and also to decrease the risk of heart disease. We want to choose healthier cereals, though. We don't want to choose the Honey Nut Cheerios, but we could choose the regular Cheerios with either skim milk or soy milk. That is fine. Starches are going to be fine for diabetes also. We just have to choose the healthier starches. So, for example, if we're looking at bread, we're going to switch from the white bread to the whole grains or the wheat bread. If we're looking at regular pasta, we need to go ahead and switch to the wheat pasta instead. If a person likes their potatoes, their white potatoes, we're going to need to go ahead and switch from the white potatoes to the yams or the sweet potatoes. And if a person likes to eat their flour or corn tortillas, it may be a good time to consider choosing either lettuce wraps instead or choosing wheat tortillas instead. Let's see if there's some other good questions here. One question is, how do you get the sugar down if a person notices that initially the sugar is elevated? Well, it can be, it's something that can be easily done. We do know that, for example, if a person gets elevated sugars, exercising will decrease it. I've seen several employees at Kelsey-Seybold during their lunchtime go up and down the stairs after a meal, and that really seems to help out. We know that the exercise in the morning seems to help out with metabolism. For anyone who has risk of diabetes, exercising and keeping the heart rate at the fat burning zone is very helpful. Even 5 to 10 or 15 minutes after a meal is great. The fat burning zone for most people is going to be 220 minus your age multiplied by 80%. And what this gives you is a number where your heart rate needs to be so it promotes fat loss. And this is important because when people are exercising, if they're exercising too high above that, there's a risk of burning muscle tissue, which will decrease the metabolism. So we definitely want to keep people healthy and also in the fat burning zone. Another good question is, does Metamucil help to lower blood sugar or cholesterol? As we mentioned before, I still think it's very important to incorporate healthy fiber into the diet. Things like Metamucil or Miralax are fine. We know that things like Cheerios can sometimes decrease the risk of cholesterol and possibly with sugars, in addition to all those lifestyle changes that we've talked about. Another good question is, if a patient is starting insulin, can it somehow be switched to tablets in the future? That's a very good question. Sometimes for some people, if they had such poor lifestyle changes and the sugars were so high that it can't be measured, sometimes we need to temporarily get their sugars at a more normal level so they can function. And so, for example, if someone's sugars were consistently, for example, 500 before a meal, sometimes the tablets may not be enough. So, for example, my patient who was eating the 2 boxes of Chips Ahoy cookies with the unlimited Kool-Aid, we needed to start him on some insulin temporarily until he made better lifestyle changes, and then we wound up switching him to tablets instead, and he's doing a lot better. The plate method is another question to see if it's helpful. It's good to think about portion control. And so if you look at your hand in your fist, that's the size of one small portion. And so the easiest thing I tell my patients is, instead of using those big dinner plates, whip out one of those appetizer plates. And on 1/4 of the plate, make that your protein. Ideally, it would be either chicken or possibly fish like salmon. That's going to be your protein. You can still have one starch, so the starch is the size of the fist. And then the half of the plate should be veggies. Ideally, in terms of veggies, we do know that the uncooked vegetables are going to be much healthier for you. The steamed veggies are fine, but if the vegetables are cooked too much, a lot of the nutrition is lost. But most of my patients have found that if they use smaller plates, and also if you choose different color plates, most time the appetite is different. If you looked at Dr. Oz, we know that red plates apparently stimulate the appetite, and so if you choose other plates than red, your appetite will be a little bit diminished. We also know that drinking water with a little bit of lime or lemon can also decrease the appetite during meals. Looks like we're almost out of time. We have one more question. Let me take a look and see what we can do here. Here's a very good question. Once the fear factor is gone, how do you motivate the new diabetic to continue with lifestyle changes? I think it's very important for a person who has diabetes to establish care with a primary care physician that they can see and that they trust. It's all about making the small changes. When I see my patients, we celebrate little things together. If we're able to get the sugars a little bit lower, the blood pressure lowered, the cholesterol lowered, most of the time patients will feel so much happier when they feel their energy level is improved. And it means that we need to continue the good lifestyle changes that help them get to a better place. Thank you again for letting me talk with you about diabetes health. It's always a joy. I'm Dr. Christine Lay at Kelsey-Seybold. I'm a family physician at the West Clinic.
I want to thank Dr. Lay for presenting today and remind everyone that next month we have another webinar Wednesday. If you would like to see more information about that, you can go to Kelsey-Seybold.com/webinars. The presentation will be Less Jiggle, More Jingle, Have a Healthy Holiday Season with Dr. David Morris of Kelsey-Seybold's Cinco Ranch Clinic. Thank you everyone for attending today and have a great day.